Expanding the rollout, Moderna's COVID-19 jab is now available at more vaccination centres nationwide.
New findings from a local study, patients who have recovered from COVID-19 may be at risk of developing blood clots.
And Hong Kong Chief Executive Carrie Lam says travellers don't need to be vaccinated for bubble flights to Singapore. Welcome to The Big Story, coming to you live from the Straits Times newsroom. I'm Olivia Quay.
I'm Haryanto Dimana. You can subscribe to the Straits Times channel so you never miss a single episode. 14
new COVID-19 cases confirmed today, all imported. They had already been placed on stay-home notice upon arrival in Singapore. More details will be shared later tonight.
Pfizer or Moderna as well. You can now check which COVID-19 shot is offered at your nearby vaccination centre. 11 centres out of the 38 so far are now administering Moderna's vaccine.
In the central area, they are at the community clubs in Radin Mas, Kolam Ayer, Buona Vista and Potong Pasir. It's also being administered at Tampines East Community Club in the eastern part of Singapore.
Marsiling Community Club, Woodlands Community Club, Kebun Baru Community Club and Punggol 21 Community Club in the north and northeast.
As well as Hong Kar North Community Club and UT Community Club in the west. Now, if you go to this website, there's a list of the other 27 vaccination centres administering Pfizer's vaccine. The clinics and polyclinics are listed there too.
Hong Kong's Chief Executive Carrie Lam said today that Singapore won't impose a requirement on travellers from Hong Kong to be vaccinated before their trip. Speaking ahead of her weekly Executive Council meeting, Mrs. Lam expects an early indication of agreement between the two sides. Last month, the Hong Kong government had announced its proposal that passengers intending to take the Singapore-Hong Kong quarantine-free bubble flights will be vaccinated prior to their trip. Around the same time, our Transport Minister Ong Ye Kung told Parliament that there were no plans to require travellers to be vaccinated in order to enter Singapore.
And according to Malaysia's Foreign Minister, Prime Ministers Muhyiddin Yassin and Lee Hsien Loong are expected to meet in Singapore on May the 4th. Among other things, both leaders will discuss the reopening of the border.
We've heard about COVID-19 potentially leading to long-term effects even in recovered patients. Now, a new study led by scientists at Nanyang Technological University has highlighted yet another possible consequence of the disease: blood clots.
That's right. The study found that the coronavirus can lead to a prolonged immune response, which in turn causes blood vessel damage and increases the risk of blood clots.
Here to tell us more is the study's principal investigator, Assistant Professor for Vascular Medicine, Christine Cheung. Prof. Cheung is from NTU's Lee Kong Chian School of Medicine. Prof, what did your study find with regard to the link between COVID-19 and blood clots?
Our study is motivated by the need to better understand the long-term health consequences of COVID-19. We found in 30 COVID-19 recovered patients that they have an elevated degree of blood vessel damage. And this in part could be contributed by an overactive and persistent immune response that could cause inflammation and damage to the blood vessels. In turn, these blood vessels may become leaky and release factors that trigger the formation of blood clots, as seen in the complications that were experienced by recovered COVID-19 patients weeks or even months after the initial recovery.
Right. So, Prof, as your team gathers more information about this, how would the findings shape guidelines when it comes to recovered patients who have been discharged from hospital?
Indeed, post-hospitalization care is very important. Recently, World Health Organization has made a recommendation for hospitalized COVID patients to be prescribed low-dose anticoagulants, in other words, blood thinner, and whether these should be extended to recovered patients after they have discharged from hospital will warrant further research and more clinical studies. But if these patients continue to experience lingering symptoms such as fatigue, breathlessness, and especially chest pain, they should seek medical attention immediately.
Right. Also, based on the findings of your study, Prof, should people with existing cardiovascular conditions then be prioritized for COVID-19 vaccination?
As we know, there is a national strategy in place for vaccination prioritization. So the older people are being prioritized to receive their jabs first. And in general, older people tend to be the ones that have certain underlying chronic conditions, and I believe they can be covered under this appropriately.
Prof, you mentioned earlier that there were only 30 participants who have recovered from COVID-19 in this study so far. Considering other limitations and existing studies on long-term effects of COVID-19, what are your next steps in the research?
We recognize the constraint with the current study, and in fact, there is an ongoing national effort to really understand a whole spectrum of the long-term health effects of COVID-19, also spearheaded by the National Center for Infectious Diseases. And we are hoping to contribute the biological understanding of their blood vessel damage and continue to work with clinicians to relate how would that predispose to the risk of blood clot formation in the long run.
Okay, we appreciate your insights, Professor Cheung. Good luck with the study, of course. We've been speaking with Assistant Professor Christine Cheung from the Lee Kong Chian School of Medicine at NTU.
Our COVID-19 battle isn't over yet, and Singapore is continuing to beef up its preparedness for other infectious diseases outbreaks.
For instance, the Stronghold Diagnostics Lab currently used for COVID-19 testing can be repurposed for other screening efforts in the future. If you recall, the lab was set up to boost national PCR testing capabilities and has been operational since mid-2020.
Deputy Prime Minister Heng Swee Keat toured the lab yesterday, and in a Facebook post, he thanked the scientists and researchers at A*STAR and other research institutions here for their work.
Mr. Heng, who chairs the National Research Foundation Board, added that he was glad A*STAR worked closely with Singapore's broader R&D ecosystem and private companies to develop solutions for COVID-19. Well, let's take a wider look at Singapore's infectious diseases preparedness with Science and Environment correspondent Audrey Tan. Audrey, could you give us an update on the preparedness front, facilities, hardware, research and so on?
So one of the latest updates on this front will be the Stronghold Diagnostics Lab that DPM Heng Swee Keat toured yesterday. So even though this lab was up and running since the middle of last year, I think this is the first time that details of this facility were actually given by A*STAR today. So it's basically an initiative of A*STAR and the National University Health System and with Temasek Foundation as a supporting partner. And it was set up to boost polymerase chain reaction testing capabilities in Singapore. So, remember the early days of the pandemic when everyone was talking about the need for testing. PCR is considered the gold standard test to detect fragments of the virus in patient samples. And even though vaccinations are ongoing, testing still remains very important for Singapore. We have seen how people who get vaccinated can still get infected, and people can get reinfected even though they have already recovered. So it's important to continue testing people to ensure that, you don't see new outbreaks in Singapore. So that's one of the new things that that Singapore is looking at. And A*STAR has said that this facility can also be used to screen samples for other infectious diseases of the future. So that's one. And on the vaccine front, everyone's very excited about vaccines now. We've also heard that one pharmaceutical company, Sanofi, will be setting up a vaccine production center here in Singapore, and that this facility will be able to produce 3 or 4 different types of vaccine technologies simultaneously, including the new ones like mRNA, which is the technology that the COVID-19 vaccines approved for use in Singapore are using. So, these are just some examples and very important elements to preparing Singapore to prepare for future infectious disease outbreaks.
Right. Looking ahead, Audrey, what are Singapore's plans to establish the country as a leader in this field of ID preparedness?
So earlier I mentioned testing and vaccines, and these are, I guess, what some of the more visible parts of infectious diseases preparedness. But of course, behind the scenes, there's also research, and that continues to go ahead as Singapore looks to recover from COVID-19. And one thing that was announced, I think, late last year when the new funding tranche for research in Singapore was announced, it included a new PREPARE program. So PREPARE stands for Program for Epidemic Preparedness and Response. So under this program, it's meant to basically harness all of Singapore's scientific minds to transform discoveries into solutions, whether it's pinpointing the source of the outbreak to developing drugs or vaccines. And some of the possible research collaborations that could be carried out under this program includes working with researchers in the region to keep a close watch on pathogens circulating in animal populations. As we all know now, the coronavirus that caused COVID-19 is very likely to have jumped from an animal to a human. So that's why it's important to continue with such surveillance. And also fine-tuning models to understand how the disease spreads and how to keep it under control.
All right.
So I think research is a really important pillar.
Well, thank you so much, Audrey, for the updates. That was Science and Environment correspondent Audrey Tan.
A quick roundup of today's top headlines. For the first time, Canada has more new COVID-19 cases per capita than the US. Over the past 7 days, the country recorded over 22 new cases per 100,000 people. Ontario is the hardest hit, with ICUs full and all but emergency surgeries cancelled.
Japan will be releasing water from the stricken Fukushima nuclear power plant into the Pacific Ocean after it was treated to remove harmful radioactive substances. The discharge of more than 1 million tons of processed water will commence in about 2 years and take place over 3 decades. The move has been backed by the International Atomic Energy Agency, but has met opposition from local fishermen who fear the reputation damage on marine produce. Neighboring countries, China and South Korea, have accused Japan of a lack of transparency and consultation behind the decision. Beijing called the move extremely irresponsible and claimed that it would be damaging to public health.
Well, back home, tech giants Google and Apple topped the list of Singapore's best employers of 2021. Dominated by American companies, the list ranks the top 200 best employers here, with the scoring system based primarily on whether staff would recommend a company to a friend or family member. More than 9,000 people responded to the online survey conducted last August and September.
The number of condominium units resold last month hit the highest since May 2011 as sales rebounded by 28.9% from February. Sales are also 122.5% higher than March last year. Meanwhile, condo resale prices edged up 0.1% from February, rising for the 8th consecutive month.
Well, those are our top stories for today. For more news and videos, visit straitstimes.com and subscribe to our YouTube channel by hitting the red button below.
Once again, I'm Harian Tudiman with Olivia Quay. Join us tomorrow for more stories on A Big Story.